Hello, my name is Tom Stinchcombe. I work at Duke Cancer Institute in Durham, North Carolina. I'm a thoracic oncologist who specializes in clinical care as well as clinical trials for patients with thoracic malignancies. Malignant pleural mesothelioma is a disease strongly associated with asbestos exposure, but importantly, many patients don't have a known asbestos exposure. And so when I see a patient with malignant pleural mesothelioma, the first thing we ask is, we work with our thoracic surgeon, is this patient a potential surgical candidate, or are they unresectable at this point? The majority of patients are found to be unresectable, and then we'll get systemic therapy, generally but with medical oncology. Historically, the standard was cisplatin and pemetrexed, which was compared to cisplatin alone. And this combination was really approved greater than 15 years ago and was the standard. Other studies have shown that you can substitute carboplatin for cisplatin and can do the carboplatin pemetrexed with a reasonable outcome. And one European study showed benefit to cisplatin pemetrexed and bevacizumab. And so that was an option, adding the angiogenesis therapy. And I think that the field was sort of stable for a while, and there'd been some promise of immunotherapy with several trials in the second and third line setting. One in the second line setting showed single agent pembrolizumab was similar to single agent chemotherapy. And a recent trial at World Lung showed that single agent nivolumab was better than best supportive care. And so there was a signal that immunotherapy may have activity. But I think the thing that really sort of changed the management of these patients was the recent phase trial that compared the immunotherapy combination of nivolumab and ipilimumab to platinum pemetrexed. This is two immunotherapy agents. One hits the PD-1, PD-L1 axis, and one hits the CTLA-4. So when I talk to patients, I describe this as sort of double immunotherapy. And it was when the combination was compared to the chemotherapy, it was found that in the intent to treat or the study population, there was a longer survival with the immunotherapy combination compared to chemotherapy. And then when they did subset analysis, they found that the benefit was more pronounced in the patients with non-epithelioid malignant pleural mesothelioma. And this is a subgroup that's thought to have a more aggressive disease, and the benefit was a little bit more pronounced in that group. But I think when I make a decision to treat, I generally focus on the intent to treat patient population and the benefit there. The combination, as all immunotherapy combinations, can cause some immune-related adverse events, or what I describe as some inflammation of the lungs, liver, colon, and skin are the most common, and these cause cough. The inflammation of the liver can cause some increased LFTs. Increased inflammation of the colon causes diarrhea, and the skin can cause rash or itching. I think that of those, the immune-related pneumonitis is the one that's the most concerning to us, because I can present with cough and shortness of breath and be sudden onset in a patient who already has an underlying pulmonary process. The other side effect that we have to monitor for is it can cause hyperthyroidism or hypothyroidism, so we routinely check the TSH. We can manage these side effects, as daunting as they sound, with prednisone for 4 to 8 weeks, and so that they are manageable. And when I talk to patients, I think that I really emphasize patient education in terms that if you're having 3 or 4 loose stools, don't wait out for the next doctor's appointment or the things. You have to call us and you have to let us know so that we can intervene early rather than we can intervene late. And this was recently FDA approved. I've used it several times. I haven't had any insurance barriers or any other issues. So I think that many of the payers have recognized that this is an advance. And I think that this is an important advance in disease that really are from a systemic therapy standpoint, things have been fairly stagnant for a period of time.